Now let's pay a little closer attention to the census findings today dealing with aging Canada. Canada's working population older than it's ever been. Seniors are one of the fastest growing segments of the population, presenting some serious challenges for policymakers. Laura Tamblyn Watts is the founder and CEO of CanAge, a national seniors advocacy organization. She's with me now. Laura Tamblyn Watts, good to see you again. Thanks for taking time to speak with me. Look, the latest census data shows seniors over 85 among the fastest growing group in the country. The numbers show we have an aging society. By 2050, the 85 and older population could reach more than 2.7 million people. What do you see in these numbers?
We see a confirmation that Canada is aging very rapidly, in fact, faster than even we had expected. The numbers to take away are 1 in 5. So 1 in 5 people right now are already over the age of 65. And it's important to note that we have more people who are getting ready to retire between 55 and 64 than we have the whole of the group entering into the workforce between 15 and 24. So this is a massive demographic shift, and it's only going to get more profound.
What do these numbers mean, do you think, for healthcare and elder care systems in this country? What's the message here?
We need a plan. We have been absolutely refusing in this country to create a national senior strategy. And so that means that we don't have any overarching plan as other countries do. And what that means is for people who are trying to make decisions about where money should go or how we should create systems, they don't really have aging in mind. This is particularly true when we're thinking about the really strong impact of aging in rural communities where the average ages are well into senior years. And we know that we've been relying on them to come into urban centers to get things like healthcare. And that's just not going to be possible in future. So we're going to really need to make sure that we're thinking about aging when we're designing systems. And that's something we haven't done.
You touched on it. I want to hear more. You talked about what other countries are doing. There's lots of discussion today about how Canada's left this too late, that we're behind the 8 ball, well back on the curve compared to other developed countries. What can you tell me about that?
We have steadfastly refused to look at aging for no good reason, frankly, but ageism. And because governments often look for short-term solutions, and this is a demographic shift that's been going for a long time. If we think about the other OECD countries, we're aging about the same as them. We're a little bit younger than, say, Japan or Germany, which are super aging populations, but they have been thinking about this for a long time. They've been putting transportation mechanisms in place so people can get around more easily if they're not driving. They've been creating mobile units to help people get home care, and they've been able to bring services to people. It also means they've been thinking about the labor force much more than we have. We're really going to be short on people both taking care for seniors, but also just short of people to work generally.
Let's dig into that a little bit. This added challenge of having an aging population that needs more and different kinds of care, but most of those people are out of the workforce, and so not paying for the change that's needed, and population growth is so slow. How do we deal with the budget challenge of paying to support that aging population?
We really need to keep people in the workforce longer as much as possible. Then they're not only filling the jobs, but they're also paying into the coffers of government. And so that idea that we've had, very ageist idea that we need people to leave the workforce so young people can come in, we have to bust that notion open. That means more flexible jobs. That means that we need to be aware of things like caregiving leave and more remote work. Some of these things we've actually solved or taken big steps forwards during the pandemic. So I think we can have a more flexible workforce, and that will help. But if we're not investing smartly, we'll be throwing good money after bad government-wise, and I fear that's where we are right now.
Okay. In your view, talk about investing. We just had the federal budget. Does the federal budget, in your view, capture the urgency of this challenge in front of us?
Not at all. In fact, we were surprised to see how little there has been for seniors. What the federal government needs to do is take the mega trend of aging and do the same thing it's done with the climate change emergency or gender-based issues, which is to make sure that they are requiring all the ministries to focus on this as a priority and to report upon it. By contrast, we have a minister for seniors who is trying hard but really has no staff or no budget. and really nobody else in the government is taking this seriously. It seems, if you look at the dollars, you're not going to find them for seniors' issues.
30 seconds or so left. The Ontario budget tomorrow. Let's talk about the provincial level. What do you hope to see by way of perhaps new supports for seniors in that province that saw such a loss during the pandemic of seniors in that province, and how hard Ontario was hit? What are you looking for?
We're seeing that the platforms of the NDP and the Liberals have already dropped, both of which have lots in there for seniors' care. The Liberals dropped their platform yesterday and saw $2 billion for home care, and they're promising a reinvention of seniors' care. The Ford government has been much more conservative on that and really hasn't taken it as seriously. We'll see what their budget is tomorrow. I think we'll see some short-term promises, but not long-term action.
All right, Laura Tamblyn Watts, thanks for your perspective again tonight, and take care. We'll talk soon.
Thank you.